The US turned a corner with its handling of the pandemic. The latest release of the Bloomberg COVID resilience ranking, which measures the best places to be in the coronavirus, shows the US climbing 8 spots in February to 27th. We caught up with Bloomberg's health editor, Rachel Chang.
So what we see in the ranking this month is that, globally, the picture is much more optimistic than it was a few months ago. So the pandemic overall is losing momentum and cases are growing at the slowest pace since last October. And because of the way the ranking is designed, it's the 53 economies are ranked against each other. So with the US's jump up the ranks, we can see that the US is improving faster than the global picture as a whole. It is at a turning point, a potential turning point in the pandemic where we see cases have dropped over 40% from a month ago, and mask wearing, which was, very much turned into a politically polarizing act in the US, is at an all-time high of 77%. And economists also expect the US to have a faster than expected economic rebound. We know that the new US President Joe Biden is set to pass a 1.8 trillion stimulus plan. So overall, the US is climbing up the ranks. Its overall ranking is still quite low because it still has the world's worst outbreak. It just marked 500,000 deaths from the entire pandemic, which is by far the worst death toll amongst all countries in the world. But there are lots of positive signs right now. So we see that Australia is moving up into second position after they lifted a lockdown in Victoria State. Situation in Australia right now is very positive. The virus has been virtually eliminated, and they've ordered a lot of vaccine supply. So they're in as good a position almost as New Zealand, which has been number one ever since the ranking started in November. At the same time, we see Taiwan, which used to be just behind New Zealand, drop this month because they experienced 2 COVID-related fatalities, which off of a very low base of local virus transmission, basically no local cases at all. We're seeing rich nations like France and Belgium, which were previously in the bottom 10, they've steadily climbed out of that. And the bottom is now dominated by very much developing economies. And we're seeing that rich-poor disparity emerge on the ranking. And given the way that rich nations have sold up all of that vaccine supply, which is something that the WHO has been saying is very unfair, we expect that rich-poor disparity to continue on the ranking. So the variants are very much that black swan wildcard that could really cause this positive momentum that we're seeing across the world to turn bad again. We are seeing the South Africa variant, for example, to be quite dangerous and vaccines to not be as effective on these variants. So we do know that the vaccine makers are now designing different booster shots and designing different types of vaccine products to fight against those variants. But the problem is that the variants are highly transmissible and could spread faster than our vaccines can keep up. So the situation in Israel, for example, which we know is the fastest vaccinating country in the entire world, and is going to reach herd immunity very quickly. What we're seeing with Israel on the ranking is that the UK variant had spread so badly and so quickly across the entire country that its outbreak was basically at the highest infections per capita, one of the highest in the entire world. So while the vaccines are making a dent now, they still haven't been able to tame those infections down to a level that we're seeing in the top performers like New Zealand or Taiwan. That will still take a lot of time. So it's definitely a race against the variants. And in that race, the question really is, can we redesign these vaccines and deploy them fast enough to keep up with the variants?